Good evening, friends. Welcome to my channel. Today our topic is jaundice. What do you mean by jaundice? Jaundice is nothing but yellowish discoloration of skin, mucous membrane, and sclera of eyes. Most people will be suspected for jaundice due to yellowish discoloration of eyes. Do you know what is the reason? As sclera contain elastin, which can easily bind with bilirubin in the blood. So it is the first part to get yellowish discoloration, and which may lead to suspect for jaundice. Well, let's coming to the topic. What is the total bilirubin level in the blood? You know that it is 1 to 1.2 mg per deciliter, and the total bilirubin contains both conjugated bilirubin and unconjugated bilirubin. I'll explain these terms, what is conjugated and unconjugated in meanwhile. But till then, please remember that the conjugated bilirubin level is up to 0.3 mg per deciliter, and unconjugated is from 0.2 to 0.9 mg per deciliter. So where does from this bilirubin comes? As you all know that RBC contains hemoglobin. In the reticular endothelial system, mainly in the spleen and liver, these RBCs get lysed and the hemoglobin, the HP part, gets converted to heme after lysis, and then heme gets converted to biliverdin with the help of heme oxygenase. The biliverdin gets converted to bilirubin, which is conjugated in the liver. The bilirubin is taken up by the hepatocytes and conjugated in hepatocyte with the help of enzyme. This is the enzyme part, which is UDP glucuronide transferase, and which then gets converted to bilirubin glucuronide, which is excreted into the intestine. So what is the term that is conjugated or unconjugated? The bilirubin which is not attached to this glucuronide compound, prior to it, it is called as unconjugated bilirubin. It is called as unconjugated because it is ligated with this glucuronide compound, and thus it cannot be excreted or soluble in water and cannot be excreted in urine. Okay, it is unconjugated, that means it cannot be soluble in water, and after this conjugation, that is with UDP glucuronide transferase, it can be soluble in water. That is why after conjugation it can be easily excreted through bile into the intestine. So let's come to this part. The bile contains bilirubin. So as we have already discussed, RBC which is getting lysed in reticular endothelial system, bilirubin is being released, which enters the hepatocyte, taken up by the hepatocyte, and getting converted to conjugated bilirubin with the help of UDP glucuronide transferase. What this enzyme does is it adds 2 molecules of glucuronide to bilirubin and converts it into conjugated bilirubin, which can be easily excreted in the bile into the intestine. Now, after reaching the colon, the bacteria inside the colon converts the conjugated bilirubin to urobilinogen. This urobilinogen again gets reabsorbed into the intestines, entering the enterohepatic circulation, reaches back the liver. So after reaching the systemic circulation, it is again getting excreted in urine. Part of it is getting excreted in urine. So what I mean to say here is, bilirubin, although it is getting excreted into the intestine and passes away in the feces, it is also being partly excreted in urine. So we'll see the yellowish discoloration of urine. Pale yellow discoloration of urine is due to this urobilinogen, and the brownish discoloration of feces is due to urobilin and stercobilin. Urobilinogen gets converted to urobilin, which gives dark brown color of the stools. Okay, is this part clear? And next, coming to types of jaundice. Jaundice can be broadly classified into prehepatic, hepatic, and posthepatic jaundice. So what is prehepatic jaundice? Prehepatic jaundice is nothing but prior to liver, before liver, and hepatic is there is some issue in liver itself. Posthepatic is there is some issue after the liver. So coming to here, there is some issue before the liver. You take this part as liver, and before this there is some issue in the reticular endothelial system or RBCs. What is that? If many RBCs are getting lysed in the body due to some autoimmune hemolytic anemias, hereditary spherocytosis, thalassemia, sickle cell anemia, there are many reasons for hemolytic anemia, as we all know. So if in any of these causes, there will be excessive lysis of RBCs. So there will be excessive production of bilirubin as well. So the liver cannot perform conjugation of all the huge load. So the problem is prehepatic. Next, coming to hepatic. If there is some viral infection, viral hepatitis leading to viral hepatitis like hepatitis A, hepatitis B, hepatitis C, there is decrease in function of hepatocyte and this enzyme. So there will be rise in both conjugated as well as unconjugated bilirubin, as the liver cells are partly functioning. Next, coming to post-hepatic. What do you mean by post-hepatic? After the liver, what is this? This is the hepatobiliary system. So if there is any gallstone here, or any pancreatitis, or any periampullary carcinomas, this is ampulla of water, right? Any periampullary carcinomas, any gallstones, any pancreatitis, acute or chronic, it can lead to obstruction of bile outflow, which may result in increase in conjugated bilirubin levels in the body. So when do you call it as unconjugated hyperbilirubinemia? unconjugated hyperbilirubinemia. If the unconjugated bilirubin is more than 85% of the total bilirubin, then it is called as prehepatic jaundice. Okay. So here if you observe, in prehepatic jaundice, there is increase in unconjugated bilirubin. Okay. But what about conjugated bilirubin? Is that all the conjugated bilirubin is absent in prehepatic jaundice? No. Some part is being converted to conjugated bilirubin, but the load of unconjugated bilirubin is very high, that is more than 85%. So what does this unconjugated hyperbilirubinemia gets accumulated in the tissues? It cannot be passed out into the bile or excreted through urine because it is insoluble in water. But the conjugated bilirubin, which is less than 15%, as you can see here, it can get excreted into the intestine, and as you can see here, this is liver. Once if the bile is excreted, bilirubin is being excreted into the intestine, the conjugated bilirubin gets converted to, as you all know, urobilinogen, right? And the part of urobilinogen again get entering into the intrahepatic circulation, and this intrahepatic circulation, it reaches to systemic circulation, and part of it gets excreted through kidneys. So as you can see here, urobilinogen is present in urine and feces. The reason is the conjugated bilirubin is less than 15%, which enters the intestine and being converted to urobilinogen through bacterial in the colon, which enters the intrahepatic circulation and is being partly excreted in kidneys. So the color of stools and urine here in prehepatic jaundice is brown color. Well, next coming to posthepatic jaundice. What happens in posthepatic jaundice? There is obstruction. So there is nothing coming into the bile, that is no conjugated bilirubin is coming into the bile. So urobilinogen is absent. So intrahepatic circulation is absent. Nothing is excreted into the kidneys. So there will be pale stools and pale urine in the posthepatic jaundice. Next, coming to hepatic jaundice, there is mixed rise in conjugated and unconjugated bilirubin. So the urobilinogen in stools and urine, the urobilinogen in urine and stools are on the lower side because only part of conjugated bilirubin is being getting excreted into the bile. So it may resemble the normal stool and normal urine color in the hepatic jaundice, as this is due to viral hepatitis. So this is the basic introduction of jaundice. You can post your comments in the comment section and ask for any queries. Thank you.